and the intervention needs to occur at multiple levels as well. So the model is useful not only in identifying what are all the causes and contributors to health and negatively health disparities, but also the model is really useful for identifying multiple areas for policy intervention, with the important statement that prevention happens more upstream in the model at these higher levels of influence. Quickly, when we in public health talk about prevention, we think about primary prevention, and that's interventions that could prevent an illness, condition, or disparity from happening in the first place, versus secondary prevention, which includes interventions that don't totally prevent a problem from happening, but might allow intervening at an earlier stage and thus allow an opportunity to reduce risks of morbidity, mortality, or disparities. Some quick examples in thinking about kids, primary prevention efforts are things like immunizations that prevent a child from getting an illness in the first place, banning lead paint, cash and food assistance to low-income families, supportive housing. These things we think actually do have a positive and fully preventive impact. They produce better health. Some examples of secondary prevention are screening a home to see if lead is in the home and then removing it. The lead's already there, but now we're going to remove it. Screening kids for lead poisoning. The EPSDT program in Medicaid, which stands for Early Periodic Screening, Diagnosis, and Treatment. It's a program for children on Medicaid that really promotes the early screening and diagnosis of any kind of health issue in a child so that the treatment of that can occur at an earlier stage. And adverse childhood events, ACEs, AIDS screening in healthcare settings. This doesn't prevent a child from having experienced trauma, abuse, neglect, or other kind of adverse childhood event, but screening for it can identify it earlier and then have a better chance of also then identifying how to help assist the child who's experienced that. I will just say, when you're thinking about screening and secondary prevention, the cardinal rule in public health is that screening without any kind of follow-up is considered ineffective and unethical. It doesn't do any good to, say, screen for kids for lead poisoning if you're not going to do anything about it. It doesn't do any good to screen children for adverse childhood events if there's no connection to services, again, or follow-up for it. So keep that in mind. I believe I've said these things already about where policy might be able to intervene, and I have a bunch of slides on policy now. I'm going to go through them pretty quickly, and I believe these slides will be available to you afterwards. But one point I want to make is when we think about policy, we can think about policy at the, as laws and regulations, court rulings, as it says on the slide. And it is true, policy people do talk about policy as being policy with a big P and policy with a little p, which doesn't sound all that sophisticated, but in fact, these are common ways to refer to policy among people who design and study and implement policy. So again, policy with a big P is really formal public policy, and we tend to think about these things as being interventions where there's consequences for not following the policy or violating it. And we also tend to think about policy with a big P, again, laws, regulations, administrative rules, executive orders. They do tend to have an impact on a large number of people. But there are also ways to intervene outside of creating new laws and regulations. And we refer to this as policy with a little p, ways of intervening that are smaller in scope, they're less formal, there tend to be weak or no consequences for not following, but they certainly can have a big impact on health. And these things can be happening at every level of the socio-ecological model. So this is things like guidelines, issued by professional associations, recommendations of expert panels, policies or rules within institutions. here's some examples of policy with a big P. Again, the Medicaid EPSDT program. The Environmental Protection Agency regulations regarding lead levels in municipal water supplies. There are standards for that, and if water supplies in cities exceed those standards, action is supposed to be taken. Notwithstanding what happened in Flint, Michigan, just 60 miles away from where I'm sitting right now, but again, there are these regulations for what's supposed to happen when lead levels and water supplies exceed certain standards. Talked already about federal laws banning lead paint, leaded gas, et cetera. Here's some other examples here. I actually do want to point out that we do think about policy in terms of an absence of a law. You can think about policy in that way as well. So right now, there is no national law, and in most places, there's very few cities that actually have laws that require landlords to remove known lead paint. So the absence of that policy is why there is remaining lead paint that's chipping and provides a huge health hazard to lower income children in this country. That's a policy. It's not required. But then we can think about, okay, so what can we do if we don't have laws? What are some other things we can do to intervene? And I have some examples here. The second bullet point is, and this is an example of policy with a small p, subsidies to landlords to engage in lead paint abatement in their rental properties. They don't have to do it, but what if you tried to nudge them to do that, to do it by giving them, the government could give them some money, give them a subsidy to cover the costs of that. Again, important point is the more you're aimed upstream in structural determinants of health at these higher levels in the socioeconomic model, the more you're going to be engaging in primary prevention and preventing these disparities from happening in the first place. I have many examples here of policies way upstream that are really aimed at trying to improve the socioeconomic conditions within communities, within neighborhoods, within families, and then for individual children, because we know that poverty is the #1 mechanism by which social disadvantage translates into social disparities in health over the life course. But again, there's other interventions. I have some more, again, at the community level, the institutional level, the interpersonal level, different kinds of interventions. These are just examples of ways in which interventions can occur to improve health in the early childhood period. I do want to say at the intrapersonal level, so again, here now we're at the lowest level of the model and thinking about individual kids. Here we think about things like for kids who do have elevated blood lead levels, what has to happen is they need to be treated for that. And the primary way they're treated, there are nutritional therapies, but also chelation therapy needs to happen. Special education for children who do have cognitive deficits from lead exposure or other kinds of exposures. There's behavioral therapy for children, drug treatment for children with ADHD. Again, these are interventions, they're very downstream, and they're considered to be treatment rather than prevention. Sometimes people refer to them as tertiary prevention because the purpose here is to restore the child's health, but again, we're downstream now, and so we're really thinking about interventions that are treatment more than on the prevention side. So I'm going to wrap up here now and just give you some advice when you're thinking about, when you get your case and you're thinking about how you might think about interventions to address problems and issues with early childhood health. When you think about policy interventions, you really want to think about, well, is this policy with a big P versus a little p, and actually think about, okay, what are we doing? Are we making people do something? Are we prohibiting an organization from doing something? Do we have, is this a tax, is this a subsidy? So really kind of think about what is the policy lever that you're thinking about. And then really try to understand the logic and evidence behind your intervention. What's it supposed to do, and is there any research behind this? And then really think about what is the pathway by which the interventions you're thinking about will really address the health problem. Think about the level of action in the socio-ecological model. Are you aiming at primary prevention, secondary prevention? Are you really way downstream thinking more about treatment? And then this happens a lot in the policy world. People sometimes confuse or conflate policy goals with specific policies. So I'm going to encourage you to think as specific as you can about the policies that you need to achieve your policy goals. So if one of your goals is to reduce low-income children's exposure to lead, that's a goal. So then you have to think about, well, what specific policies do we need in place to do that? If your goal is to reduce childhood obesity, again, that's a great policy goal, but that's not a policy. You have to then think very, very specifically about what you're going to do. So in summary, social disparities in health are produced over the life course from causes that occur at multiple levels, in these 5 levels on the right-hand side of the screen. Interventions are then aimed at preventing and reducing these disparities are needed at all of these same levels. And policies and programs can intervene at each level to enhance the social determinants of good health and reduce the determinants of health risks and disparities. And one last time, I've said it already, but upstream interventions that address policy and community context are the most powerful ones for prevention. And thank you very much.
Hi, everyone. This is Sophie. Paula, thank you so much. That was a wonderful presentation, and I think everyone will have taken a lot from it. So very quickly, we just want to let anyone who has any questions for Paula ask their questions right now. Is there anyone on the line who has a question? Okay. Is there anyone who's trying to ask a question and might be on mute right now? A lot of you have your phones on mute, so we just want to make sure that we're giving everyone an opportunity to ask any questions.
Okay, well, we can also pause again for questions. Paula, are you staying on for a few minutes longer?
Sure.
Okay, just in case the technology is a barrier, maybe Sophie was going to talk next a little bit about the case challenge, just a 2-minute sort of overview of some of the nitty-gritty, and then we can revisit, see if there's any questions, and if not, I think we can go ahead and move on. Folks, there's also a chat function if you're having trouble speaking that you can use to send questions. But, Paul, I think your overview is so good and so detailed.
Thanks. I went a little long. I'm sorry.
No, it was so helpful. That was really actually so wonderful. Thank you. And so that could also be why we don't have many questions. It was so complete. So, all right, I'm going to turn it over to Sophie.
Okay, so thank you again, Paula. I'm just going to give a very, very quick overview, like Amy said. So as many of you may already know, this is the 5th year of the DC Public Health Case Challenge, so we're very excited about that. And the competition was inspired by Emory University's Global Health Case Competition, which many of you may also be familiar with. For this competition, though, we are trying to emphasize a public health focus, which Paula very nicely just laid out for you all. And we also want to emphasize that your interventions should be multidisciplinary. And we also want to encourage you to draw on the evidence base put forward in the work of the National Academies and reflect on how the evidence base can be used to improve population health and tackle health disparities in our hometown of Washington, D.C. So very quickly, some logistics. On the day of the event, your presentations will be due at 8:30 in the morning, and this year we have 6 competing teams. So at that time, you'll also you'll randomly draw a number from a box to determine the presentation order, and then the presentations will begin promptly at 8:40. And we'll have handheld microphones, a podium, and a clicker for you to advance your slides. And then the 4 awards are the overall grand prize, and then we have 3 category prizes, and those are the Practicality Prize, the Creativity and Innovation Prize, and the Interprofessional Prize. And then lastly, breakfast and lunch will be provided, and then there will also be a light reception afterwards. So, so that's a very brief overview of the event, and all of this information is in the guide that we had sent out earlier this week, and it will also be included in the case materials that we'll be sending out to you at noon. So with that, I'm going to turn it back to Amy.
Hi, everyone. So I just wanted to share with you some best practices that, before I do that, last call for if anyone has any questions for Dr. Lantz, for Paula about her presentation, or actually, I guess, well, we'll save logistics questions for later. Okay. So let me just pull up the chat. Okay. So I'm not seeing any. So Paula, it's completely up to you if you'd like to stay on and listen, or if you would like to sign off. Thank you again so much for providing this. I really think it will make the team's presentations much richer, having this grounding and understanding to kick things off.
Well, thank you. It was my pleasure. I am going to hop off because I have to run and catch a plane. But good luck to all of you.
Thank you.
And have fun. All right. Thanks.
Great.
Bye.
Thanks, Paula. Okay. So I am going to just provide a few minutes of some of the things that teams have done in the past that have really made them successful and brought them to winning those prizes. And we'll also send this along with some other best practices. It's just 1 or 2 pages along with the case at noon. So first, in terms of interpreting the evidence base to produce a meaningful and relevant solution, teams that have been most successful have grounded their presentation in available evidence, but don't rely on the literature-based rationale alone. So you need to consider the DC community specifically. You know, what will work for them? What will work in their context? Should it be different from what has been done elsewhere? If you're using, building off of something that has been done and shown to work, what needs to be changed to make it work in DC? And how will you address the uncertainties of, implementing something in a new area? So successful teams have also been very clear about the assumptions that they're making when they're putting forward their solution. And then keep in mind that there might be a lot of existing local programs or resources that your solution can build off of. You should definitely take advantage of the things that are currently going on in DC. You should engage the community who will participate in the solution you propose. You can absolutely go out to community members, organizations, and ask them questions, pick their brain, bounce ideas off them. That's absolutely acceptable, and in fact, we recommend it. The next sort of set of guidance is when you're presenting your solution. So successful teams really do a great job of being able to really succinctly say what their solution is doing. So perhaps early in your presentation, you can give the audience your, quote, elevator speech, the 1 or 2 sentences if you only had a couple of minutes or a minute to explain to someone what your solution does and is, giving it the essence of your project in a way that will be memorable and provide the foundation for what the folks listening to your presentation will be looking for. Describing what your solution will look like on the ground, what will actually be done during the intervention can help the judges visualize it in action. During the presentation, you can emphasize when certain major aspects of your solution reflect the needs, concerns, or, of those living in DC or those you're expecting to serve. And this is really important. Anticipate your barriers. Teams who have won in the past or been awarded prizes in the past have really done a good job of delineating what are the barriers and how they will overcome them, or if there's not a clear path yet for how to overcome them, putting that out there that is a real problem and something that will be addressed during, the program as it moves forward. Find 2 more areas. So presentation and delivery. don't rush, as I'm doing right now, trying to make up for some lost time. But, you know, don't rush through your presentation because key pieces of information can be missed or misunderstood. And it can also look like, make it seem like you weren't able to narrow down your presentation to the key and essential information. Also, during the Q&A with the judges, stand behind your case. You know, don't lead your responses with apologies. Be confident in the Q&A. If you need a moment, if you're thrown off by one of the judges' questions, it's perfectly fine to pause for a moment and then respond. You know, don't say, oh, you know, we weren't able to do X, Y, Z, because if it isn't something you hadn't, or if it's something you hadn't already considered, you know, you can say that, but then you can redirect and say, but here is what we did instead. You know, really, you know, you're working hard on these solutions, so just, you know, stand behind them. And then, you know, just while this is, I'm sure, something your advisors will talk to you about, but when you're presenting, you know, plan ahead your transitions in both the content of the slides and the verbal presentation. Just make sure it's a nice, smooth transition so that it doesn't detract from the presentation. Finally, as you know, this is a multidisciplinary case challenge. All of the teams have to represent at least 3 disciplines. And so really leverage the different experiences that you've had in, you know, your education and also in your lives in general. But bring those different paradigms, those different ways of thinking to approach the problem. You know, just saying or using the term multidisciplinary approach doesn't make it a multidisciplinary approach. This is probably one of the most difficult parts, actually, of the case challenge, and it's a very difficult in life, actually, working across disciplines. But because it's difficult doesn't make it mean it's not worthwhile. In fact, you know, a lot of the work we do here at the Academy is almost uniformly multidisciplinary. When we form our committees, we purposely bring in folks who wouldn't usually be at the table to address a certain problem because it brings a richness and different information to the table and a different way things can be approached. So really, even though ideas can clash in the beginning, if you have different approaches, you know, don't shy away, you know, talk about it, talk it through, see what's going to work for your team. It can be difficult, but in the end, it's generally worthwhile, and it'll be good practice, you know, for the future and in your future work, your future classes, and in your career. How to communicate across disciplines. So I was now going to ask Ans, who is a past Case Challenge participant from last year, to share just some from participants or competitors' experience, some lesson learned and just some information that he wanted to share with you. Ans, are you there? You can unmute your line. I will also unmute you, I think. Oh, there we go. So, Ans, are you there?
Good morning, everyone. Can you guys hear me now?
Yes.
Okay, awesome. Yeah, I don't know if I can add much to it. I think you all have done an excellent job of explaining this thing. But like a couple of quick things I want to add on to whatever has been said by Paula and Sophie and everyone. Is that when they say about time that it's 15 minutes, they really mean it. So practice this thing over and over again. And as far as like, you know, so I was thinking about like a couple of logistics related thing as a competitor in there. Also, like whenever we were presenting, we thought that our appendices were our best friends, especially during Q&As, because lots of times you cannot present all the information or your thought process that you're actually trying to convey to the judges. But if you have those details in your appendices, you can, you know, during the Q&A, you can always refer them, like, you know, oh yeah, we were actually thinking about that. Yeah, that's about it. And like, you know, have lots of fun with it. And you know, one thing is for sure, whenever academies, you know, they really want you to think big and think upstream, you know, and like don't be singing the good old song, you know, like think different, think big, think upstream, no matter how radical it may sound, as long as the logistics, you know, seem to add up for you guys, the math calculations, you'll do just fine. And, you know, I guess I understood whenever I participated in this case challenge was that it's not only for just this case, but like this case really highlighted that thing. And, you know, we learned lots of lessons during that. That you have to be able to imagine a much different world than the one we live in order to make a change, especially in public health. So again, like, think upstream, and y'all will do just fine. And I'll hang around here if you have any questions for me. But yeah, that's all I had. Sophie.
Thanks so much, Hans, and I actually really appreciate you pointing out that 15 minutes does mean 15 minutes, and also the addendums in the PowerPoints that teams can refer back to. Those are two excellent points that I'm going to add for in the future, because we will hold up cards that will say you have 5 minutes left, I think 2 minutes or maybe 1 minute left, and then 30 seconds, and then we will, even if you're in the middle of a sentence, cut you off, because all teams get equal time to present and an equal amount of time to have Q&A with the judges. And I should say, after the team's Q&A, there'll then be a 10-minute break so the judges can write down their notes, and then we'll have the next team. And one other thing actually I should mention is we're going to do team photos. We do those every year, and we'll send those to you so you also have them. If the weather's good, we have a great, huge, beautiful Einstein statue outside that we'll take those in front of, and we have a professional photographer coming. And so just keep an eye out for that information in the morning. When you get your picture taken will depend on what number you draw for the order of your team. So now I'm going to stop talking, and we have some time for questions about logistics, questions for Hans as a past competitor, anything you want. If there's questions that we can't answer, we'll just let you know that, but please go ahead. Now is the time. So if you're on mute, you can just go ahead and unmute your phone, or I'm going to check the chat here to see. There we go. If anyone has any questions. And it's possible that we were just so complete that you have no questions. I'm going to, even though silences can be awkward, I'm going to go ahead and let it be silent for a minute so folks can think about if they have any questions. And then if not, I'm actually going to turn it over to Wyatt, who is our lead case writer for the case this year, and he's going to share just a few words, and then he's actually going to let you know what the case is, what the topic is this year, and a little bit about it, and then, we're very excited about that moment. But so I'm just going to be quiet for a minute, see if anyone has any questions. You can type them in, go ahead and talk. If not, we'll turn to Wyatt.
This is more silence than my comfort.
So, okay. Well, I'm going to assume then that we've done a wonderful job. No one has any questions. Just so you know, Sophie Yang will be sending out the email at noon with the case write-up, so that includes the problem statement that Wyatt is going to tell you about in a minute. It includes the guide, the agenda. It basically has all the information you could possibly need, and then a separate attachment that has that feedback or the lessons learned that I said to you, but also some additional ones. If you have questions anytime throughout the 2 weeks, please go ahead and email us, and if it's a question that we think is relevant to all the teams, we will send an email out to everyone to share that information with everyone. If you have a question about the case specifically, we will definitely do that. Whatever the answer is, we will share with all the teams so that everyone is working from the same set of information. Okay. Well, Wyatt, I'm going to turn it over to you to say a few words, and then go ahead and share what the topic is this year.
Awesome. Can you hear me?
Can.
Okay, perfect. So hi, everyone. I'm Wyatt Binskin, and I was a case lead writer for this year. There were a good number of us, all from different schools, who participated. And so I just want to say a couple things, and then I'll get to the moment everyone's waiting for. So I just want to first say that the case was incredibly exciting for us to write. We all kind of have different backgrounds and interests, and those all came together to write the case, and we ourselves learned a great deal. And I think this translates well into what you all will be doing. And I really want to encourage you to get excited about the case and to use your unique passions and interests to come up with a really cool solution. So I'm not part of the judging at all, but I'll definitely be there, and I'm hoping to see everyone's presentations and see what you come up with. So I'm really excited, and I just encourage you to use your passions and your interests, especially that multidisciplinary approach. I think that's going to be incredibly valuable and more exciting and more fun for you to do, because ultimately I think this should be a learning experience and fun and all of that, and it shouldn't be burdensome. So dive into it just like we did in writing it. And I just want to make one other point, which is nothing we wrote in the case is intended to trick or mislead you. So if you have any questions, if you read a sentence and you don't think it makes sense, or if you see some data but you're seeing conflicting things that you found, or just something doesn't make sense, or something's not adding up, don't hesitate to reach out. Don't hesitate to ask. And like Amy had said, so if you ask the question, I'll answer it, and that answer will be sent to everyone. So I just want to really emphasize that nothing in the case is a trick. There's no gotcha moment. There's nothing in there that we're like hoping messes you up. So if you see anything like that, if you have any questions or clarifications, please, please, please do not hesitate to reach out to me, and we'll do the best we can in answering it and getting that back out to you. So with that, I'm very happy to announce that somehow I think Paula magically predicted what the case would be, but the title of the case is Lead and Adverse Childhood Experiences, Neurological and Behavioral Effects for Youth in the District of Columbia. So it's pretty interesting that we kind of have two different topics here, the topic of lead exposure, lead poisoning, and the topic of adverse childhood experiences, or ACEs. And what drew us to these is how they both kind of result in very similar neurological and behavioral effects in children. And that's what we're really hoping to hit on in this case, is that children, and oftentimes, as you'll read, in the same communities are exposed to both of these, and these end up having huge consequences neurologically and medically, but also behaviorally and in schools. And what's also very important about both of these and how they tie together is that they're both life course. So it's not an acute problem, but this is something that really begins, at childhood and even, in the womb, and extends throughout your entire life. And the topic is also incredibly relevant, as I'm sure you all know. The history of lead in Flint, Michigan has been huge over these past couple years, but what is interesting and something that I didn't know that's covered in detail in the case is Washington, D.C.'s history and kind of challenges with lead exposure and lead poisoning. So it's a very relevant problem, both nationally and locally, and I think that it really opens up the door to some creative solutions to help and to kind of focus on the youth. So far more details in the case when you get it here in 3 minutes-ish, but that's the topic, and I think Paula laid everything out incredibly, incredibly well, more than I was anticipating. We were emailing Amy, Alina, and Sophie, and we were saying, oh my gosh, how did she know? So I hope that you took something away from her presentation, and it was great that she laid that all out, and I think it will make diving into the case a little easier. So that's all I had to say. I know you'll have more questions when you get the case, but I can definitely stay on for a couple minutes if anyone has any last-minute questions.
Thank you so much, Wyatt. And yes, it's true. We had not shared. We shared with her the broad topic that the teams knew, but we did not tell her the specific topic. So it just goes to show you how relevant and timely, actually, the topic that the case writing team chose is. So that was a really wonderful surprise. We have just 2 minutes remaining, and at that point, Sophia will return to her desk and hit send on the case so you can see it for yourselves. Any last questions? Okay. Well, not hearing any, I just want to say that we are incredibly excited. I know probably everyone has said that already. This is probably the favorite thing that we work on here, our team anyway, and we're really looking forward to it and very much looking forward to hearing what you come up with in just a couple of weeks, and we'll see you soon. Thank you, everyone, and thank you, Wyatt, for all your hard work on the case, and please relay our thanks to the team and for doing a great job laying out what the case is about. All right, thank you, everyone. I am going to end the webinar. Okay.
leader has disconnected. The conference will be terminated in 5,